I want to speak briefly about activist doctors and what happens when a couple of them end up as the state's top health bureaucrats. There's been a fair deal of criticism of Victoria's Chief Health Officer, Brett Sutton, who on a number of occasions has been out of step with the far more experienced and qualified Chief Medical Officer of Australia, Professor Brendan Murphy. But this week, the focus was on Sutton's deputy, Dr. Annaliese van Diemen, who made headlines around the country with this bit of harebrained idiocy. She tweeted, "Southern arrival of an invader from another land, decimating populations, creating terror, forces the population to make enormous sacrifices and completely change how they live in order to survive. COVID-19 or Cook 7070. This is the worldview and judgement of one of Victoria's top health bureaucrats, a state that continues to impose the harshest restrictions in the country and has repeatedly defied the advice of Australia's Chief Medical Officer and the panel of medical experts advising the National Cabinet. Now, put aside the sheer lunacy and ill judgment of comparing one of history's great navigators charting the east coast of Australia 250 years ago to a pandemic originating in China. And consider for a moment Van Diemen's startling ignorance of Australian history and Western civilisation. Did she think Australia would remain untouched if not for Cook? The founding of modern Australia and all that we have achieved since should be a source of national pride. But we have allowed our colonial past to be shamefully misrepresented, with the black armband view of Australian history now dominating in schools, universities and other public institutions. You'd think a woman called Van Diemen, who received her postgraduate qualifications from James Cook University, would have learnt a thing or two about the great man, including the fact that he was long dead when the First Fleet landed in Australia in 1788. The Deputy Chief Health Officer's cringeworthy display of ignorance naturally had many people asking why a top health official is posting illogical, fringe-dwelling polemics on social media during a health crisis. Victorians have been told that we are in such perilous times that a mere game of golf, spot of fishing, or even sending the kids to school is an unacceptable risk that could endanger lives. Indeed, Ms Van Diemen tweeted a warning on April 19 to those looking for lockdown loopholes. She said, "And the next time you want to talk about not playing golf or any other loophole, please remember that all we're thinking about all the time is not filling ICUs with people you love." Talk about hyperbole. By the way, Victoria is the only state where golf is banned. For a supposedly impartial public servant who should be able to work with politicians of all stripes, Ms Van Diemen has a history of posting and retweeting highly political and partisan material, much of it highly critical of the Morrison government. She has expressed horror and shame at a government ad warning people against coming to Australia illegally by boat, and declared Australia is a racist country and she is embarrassed and ashamed because Adam Goodes was booed, which incidentally had nothing to do with his skin colour and everything to do with his antics on and off the field. When she's not posting about being embarrassed and ashamed of her countrymen, Ms Van Diemen is retweeting the likes of Benjamin Law, Clementine Ford, and even this gem from Julian Burnside, calling for Freya Newman, the young lady who hacked Tony Abbott's daughter's confidential scholarship file, calling for her to get a medal, not a penalty. And she retweeted this from another activist medic about Scott Morrison, claiming the Prime Minister is guilty of keeping children in indefinite detention until they almost died. There's hardly a far-left, highly partisan take that Ms Van Diemen hasn't expressed support for, even after being appointed as Deputy Chief Health Officer. One can only hope that her medical judgment is sounder than her warped view of Australia and Australians. But Victorians are entitled to ask, did she get the job because of her credentials and experience or her politics? Whatever the case, it's a dire state of affairs when one of the state's top health bureaucrats is exposed as a partisan nincompoop parroting infantile, fact-free nonsense during a pandemic.